So first, I would like to welcome you all to the MEAL webinar. Thanks for coming. My name is Tomáš Petracek. I am working for the ADRA regional office in Europe, in Brussels, in Belgium, as a head of programs, and I will moderate this webinar. Today, we are not going to talk about good and healthy food, nice meals, or any kind of diet, weight loss, or taste, smell, passion for food, or menus, not at all. This MEAL is actually something different. MEAL is an acronym for monitoring, evaluation, accountability, and learning. This is the subject for today's webinar. So the definition says, I was searching in internet, at the programs level, the purpose of monitoring and evaluation is to track implementation and output systematically and measure the effectiveness of programs. It helps to determine exactly when a program is on track and when changes may be needed. That's the monitoring and evaluation, but that's not enough. There are also two other components, the accountability and learning. As ADRA, we understand us as a learning organization. Having you in this webinar shows your interest in learning. Thank you for joining us in this webinar. And accountability, the presenters will share with you a little bit more about this. This is also a component of MEAL, this special MEAL. This webinar is related to the ADRA MEAL Policy, which has been approved by ADRA Network last year. The webinar will be facilitated by the members of the MEAL Technical Learning Lab. And I have the privilege to introduce the speakers. We will have a number of speakers, 4 speakers being right now with us, which also contributed to the MEAL policies, and we will have 5 presentations when we are going through. The first one will be about the MEAL systems and project monitoring. We will have Sarafidi, Rasendra Harrison, the food security coordinator from ADRA Madagascar with us. He will lead us through this topic. Then the second one will be about the project evaluation. Nestor Mogolon, the director of MEAL unit from ADRA International, will guide us through this topic. The number 3 is related to accountability, and Yetunde Odemi, technical advisor of the African Regional Office, will explain us a little bit more about. The learning will be covered by Yemisi Songo-Williams, advisor for knowledge management from ADRA International. And at the end, we will have a presentation related to the capacity and the budget, again from Nestor from ADRA International. So that's the first part. The second part is about the questions, and you have the chance and the opportunity to ask questions which will be responded by the speakers. There are 2 options how to deal with it. You could connect with the speaker either in the chat when you will write these questions, and we will summarize all of them. And the second option is, of course, to ask directly as the discussion starts. So please make your notice and stay with us all the time. And when asking questions, please let us know your name also in the office. So please continue also in the introduction as we are doing now in chat. So the questions, we have reserved the questions for the questions of 30-40 minutes. Please prepare for these questions as we are going through this presentation. So the plan for us is to finish in 83 minutes. Altogether, we have 90 minutes for these webinars. I am wishing you a perfect internet connection and good time with the MEAL Technical Lab, which prepared actually this webinar. Enjoy the webinar, and let us start now with Sarafidi. Sarafidi, the floor is yours.
Thank you, Thomas, and hello everyone. My name is Sarafidi from ADRA Madagascar. We first let thank you. Next, Fahim, please. Thank you. Okay. To assure a standard of data quality for all ADRA projects, MEAL Policy has developed to facilitate the design of MEAL system and complete the transition from monitoring and evaluation to MEAL in each project, including emergency project. So the MEAL policy aims to guide ADRA's network and their partners to monitor, collect the results and impacts of their projects, and to create a learning culture through the new knowledge identified. The use of this new knowledge allows the whole ADRA network not only to learn from the findings of each project, but also to adapt them in response to changing context and provide incentive for adaptive management, as well as including the view and concern of those with whom we are working. And this method must align with the 7 principles of MEAL, such as relevance, effectiveness, efficiency, impact, sustainability, accountability, learning, and sharing. Fahim, can you? Thank you. Next slide, please. Thank you. On the design of MEAL system, ADRA policy would like to emphasize 2 main phases. The first one is the design phase, during which the project theory documents are developed. Go ahead, Fahim. Thank you. This document will guide on how the project contributes the change in the target communities and measure the achievement of activities through objectively variable indicators. The second one is implementation phase. This phase is divided into 4 steps: the planning of MEAL activities, data collection, analysis, and use of data improve project implementation. Note that this implementation phase requires well-documented manuals and guides using by project team. The use of clear tools and guidelines will assure that all project staff have a common understanding of indicators and their collection method. Next slide, Fahim. Thank you. Now, let's talk more on detail about project design. Project design, thank you. According to our MEAL policy, there are 3 main elements to be considered, such as the development of theory of change, development of project theory, like logical framework, including indicators, result framework, theory of change, etc. Involvement of stakeholders during all process, and the development of MEAL manual for each project, including emergency. Next slide. Thank you. And for project monitoring phase, it has 6 main elements, such as assure that the data collection, analysis, and utilization are well done and in systematic manner. regular field visits, conduct periodic data quality assessments. Next slide. Oh, can you return? Thank you. Assure that project decision making is based on a good quality of data. Assure that the project has planned a periodic time for review and reflect session. And in the planning, project use appropriate tools, technology, and budget for meal activity. Thank you so much.
Morning. Now, the second section of the policy, we're talking about project evaluation. And sometimes we are scared of doing evaluation, but just want to point it out that project evaluation meaning is all the work that we have done, we need to evaluate to see the success of the project. So the policy includes in the 3 sections under project evaluation. Fahim? The first thing is that in general, the other projects around the network should conduct evaluation using the 5 principles that are already international approved by ODC, which is relevance, efficiency, effectiveness, impact, and sustainability. And now we are talking about replicability. What does it mean, replicability? It means how we can, one project or one intervention that is doing in one country or in one area, we can replicate in another area to obtain more or less the same results. And also considering with participation of stakeholders and community. Next slide. Under the operation procedures for this statement of the policy, that is, according to the policy, ADRA staff or independent third-party evaluators will conduct first baseline studies to estimate baseline values for the needed indicators, meaning that all indicators that we are going to measure during the intervention should have baseline values. And also it's going to depend on the scope of the work and the time frame of the project, that every indicator included in our design, which could be any project theory, could be a logical framework, theory of change, result change, value chain, result framework. You know, donors have different names. So every indicator included in those design must have baseline values. And that is why we have to conduct a baseline at the beginning. Also, the other part is, again, depending of the length of the project, the ADRA project should have conduct, next slide, again. Okay, need to conduct midterm reviews, or depending on the complexity of the side of the project, it could be external midterm evaluation. And the objective of this exercise is to identify the necessary corrections if the project is going on track. And something to keep in mind that midterm evaluations or midterm review are not supposed to tell us results, but it's more on the process. If we are going to we are on the way to actually achieve the results. Those midterm evaluations, again, depending of what the donor requires, also it's going to change depending of the time frame, complexity of the project, and also if the donor requires, it should be internally or external. But the most simple one, conducted by ADRA staff to be internally, the minimum is to track if there is any corrections and if the project is on track to achieve their results. Next, please. Then we are talking about evaluations at the end of the project. they are called inline evaluations of final evaluations or performance evaluations. Sometimes people say impact evaluation, but we need to be very careful about that. But the idea here is that ADRA projects should have a final evaluation. Again, the idea is here to understand the extent to which the aims and objectives of the project have been achieved, what difference had the project made in people's lives, and also the idea is to learn from the interventions that we can do in other intervention in the same country or in different countries. So that is what very important, that we do this inline performance evaluation, I will call performance evaluation or final evaluation. We need to be very cautious when we say impact evaluation, because that means totally different things. But here, the minimum requirement is that all other projects have to do either internally or third-party performance evaluation. Next, please. Then we are talking about, especially for emergency programs, the idea is that ADRA conducts real-time evaluation, especially for larger emergency projects. And the difference in real-time evaluations is that we don't wait until the end of the project to do the evaluation. That's what his name said. Real-time evaluation means that we are collecting data in the middle of the intervention so that we focus on lessons learned and that we can immediately apply those lessons to the intervention and no focus the evaluation on the impact of the intervention, but more on the formative way of doing things. That is what we're talking about here, real-time evaluation, especially for emergency programs. And I think this is the last one. Next one. Yeah. Okay. Of course, in order to do an evaluation, ADRA staff have to develop the terms of reference, and that have to be a robust terms of reference based. We need to state very clear in those terms of reference what we want to achieve. What are the objectives for the evaluation? What is the scope of the evaluation? And if it's an external evaluation, we need to be very clear there, asking the consultants what are the deliverables we need, we want to have at the end of the exercise. Sometimes people, I have seen that we give the consultant to develop the terms of reference, and that is not correct. Here we're talking about that ADRA is the one have to develop the terms of reference, because ADRA is the one that's going to pay the evaluation. So that, please be very careful on that. Yeah, this is what I want to say about evaluation. Thank you.
Thank you, everyone, and welcome to this session on accountability. Most of us are used to monitoring and evaluation as the key things that we do. But over time, for effective programming, we've had to bring in, on a global level, please, the issues of accountability, and at the same time, the issues surrounding learning. Accountability is something that we do virtually on a daily basis. All the things we do in monitoring and evaluation are supposed to show that we are responsible and that we respect the needs of others. Next slide, please. Thank you. When we're talking about accountability, we are talking about respecting the rights of the people we are working with, especially when it comes to what are their needs, what is appropriate for their situation. And we also do not go to the people with the mindset of we know. We allow room for respect for the beneficiaries and capabilities and capacities, as well as what the community has in mind and what they can contribute to us as the people who the donor has entrusted the funds to. Accountability means we're taking responsibility for our actions. That is, we just do not act for the sake of acting, but we're saying that we're backing up the actions with a sense of responsibility, and whatever decision we take, because we are working as a team, is a joint decision. I remember I had one boss who used to say it is better to take a wrong decision and get the support of everyone than for you to not take any decision at all. But in the case of accountability, we're all responsible for the actions of the ADRA staff. We are also, in accountability, we are contributing. We are looking at the changes in the lives of the people as a result of what we do. And we hold these as topmost. Next slide, please. And who are we accountable to? First of all, we all know that the donor entrusts us with the funds and with the action to take with the people for the sake of the people as well. And so we are accountable to the beneficiaries. Our beneficiaries include all the people who we carry out the action for, who the action is supposed to bring about changes in their lives. And there's no minority or majority group here. It's everyone included in the community in which we are working. We're also responsible to the communities. We are responsible to the donors who entrust us with the resources to go act on behalf of them to the people. And then we are responsible to the government stakeholders in the environment in which we are working. Even our implementing partners, like the volunteers who work with us, either the local volunteers or the people from which we get the information, we are also accountable to them. We are accountable to ADRA staff, to one another as colleagues as well. Next slide, please. Okay. Now, ADRA's approach to accountability is an all-encompassing tool, in the sense that, first of all, we try to ensure that there is equality in accessing the services that we provide. Then we involve the beneficiaries and the stakeholders in monitoring, evaluation, even in the accountability process and the learning processes. All of it, we bring in the beneficiaries because it's all about them and it's about us who are acting on behalf of the donor. And then we also believe as ADRA that we need to share information with our stakeholders, especially the beneficiaries around the project. Our partners and the donors as well, they are all involved. All those who are involved, we share information with them. We try and share information at appropriate levels. Yes, it is true that we have to talk to the beneficiaries about the project, about what the project would entail, what is it that they should expect from us, and what do we expect from them as well, especially when it comes
Okay.
Community members can tell us of what they have noticed in the way in which we're carrying out the project, the way in which we are implementing. And when they give us this feedback, it doesn't have to be positive all the time. It can be a negative feedback. It can be a challenge that they are seeing in the process, but it's key to accountability that we have the feedback and we have a response mechanism as well. Also, ADRA believes in clear reporting mechanisms to donors and to the beneficiaries. And the reporting templates, they are slightly varied because of the different projects, depending on which project we are working on. But the key thing is that we have to document. Documentation is important, is the only way in which we can track where we started and what is happening and where we are in every phase of the project. Next slide, please. The key pillars of accountability to beneficiaries includes listening and understanding the needs of the people in line with what is their right. It's not just about their needs, the rights are much more important, but we need to hear from them. And that is why we do not go to the field with the mind of we're the ones trying to bring about change. What we're trying to do is to bring about change with them, working hand in hand with them, getting to know what do they need and what is their rights according to what they claim to be their need. And then transparency is important, and that is why we share information. We share information on activities, we share information on how we hope to disburse the funds that are with us. Not only are we talking about what funds we have at hand, but ADRA has an internal tracking system for finances in virtually all offices. I dare to say every office should have a tracking system as to what happens, are the funds being disbursed according to the activities, what is the burn rate like, is it in alignment with what we claim to be doing. And then we have the internal and the external funds expenditure feedback system as well. And then it's important that when we are working with the community, part of accountability, part of our transparency is to work with the hierarchy of the community. We consult according to their own system so that they can have ownership. We do not come to impose on them how we carry out selection of beneficiaries, for instance. We talk to them and we allow them to be involved with the selection. Also, we have to ensure that, or we do ensure that everyone, whether it's minority or majority group, everyone has full access. We don't leave behind anybody. And then we follow the communication protocols for the community. That is, we work with the leadership, and in every community, we find there are different levels of leadership. And so we work with the different levels of the leadership, starting with the headman, if it's a headman, if it's the chief, if it's a local government county head, we walk through all those steps and we get to involve whatever the community leadership is, because without them, we can't get to the people at the grassroots. Next slide, please. Next slide, Fahim. Yeah, we are also accountable to the donors and to the stakeholders. Whatever funds, whatever resources we've been given is given in trust. And so we just do not go about spending resources, apportioning resources without letting the donors know. Whatever changes we are making, we do it in line with the specification of the donors, and it's part of accountability because it's a mark of respect for the owner of the resources. And so we do have to give reports to them following the requirements of MEAL, and we share along the line of successes, we share along the line of failures, or if you like to call them challenges, and then we share lessons learned as well, both with the donors and with the people we are working with. We also ensure that ADRA we ensure that we are following the MEAL system for ADRA so that we can meet the requirements of the donors and at the same time meet the standards of the ADRA network. We also share evaluation findings with the donors and with the key stakeholders. At times, the donors bring in their own evaluators, but the fact still remains that the external evaluator works hand in hand with the ADRA staff or with the ADRA staff members to be able to give a report, a documented report at the end of the day. We also work using available evidence to assess the intervention's performance. Like Nestor said, performance is key to what we are doing. And so we like to work along those lines to be sure that both the donors and the stakeholders do get to know what we are doing. I'm not sure if there is a next one after that. Yeah, thank you very much.
Thank you, Yetunde. So everyone, over the next 10 minutes, I am going to focus specifically on the MEAL principle of learning and sharing. So we've spent the last half an hour listening to and processing a good deal of information, and I want to switch things around a little bit and hear from our audience. I'm going to kick this part off with a question for you. I'd like you to tell me why this principle of learning and sharing is so important. Why does ADRA need to learn and share? Please feel free to give some suggestions in the chat. You can unmute your mic so we can hear your voice. It's been pretty quiet. But why is it that as development practitioners, that as implementers of development and humanitarian assistance projects, we need to learn and share? It's a tough crowd this morning.
So we don't repeat mistakes?
Thank you, Deborah. So we don't repeat our mistakes. Anyone else brave enough to offer a suggestion?
To contribute to the body of knowledge within the development world.
Absolutely. Thank you, Tina. And there's one from Yakata in the chat, to do things differently and change strategies that never worked well. From Polini, it aids in the transfer of knowledge and also capacity building for our peers. Yes, thank you. Next slide, please, Fahim. So all these things, yes, Abdulatif, to avoid repeating mistakes from previous projects, exactly. So all these things that you're to track changes, joint learning, yes, keep them coming. All these things that you're mentioning in the chat are the things that we considered when we included this principle of learning and sharing in the MEAL policy. The principle is designed to help us create a learning culture at ADRA. We want to put systems and processes in place that help us to pause and reflect, that help us to systematically and intentionally stop and think about what we're doing and think about why we're doing the things we're doing. So this helps our project teams to find out what is working, to find out what is not working so well, and to use that information to adapt their programs for the better. We also want to routinely document and use the key learnings that we're getting from our program implementation. You know, we're doing great work in so many different contexts, in so many different areas across the world, using so many different approaches, working in so many different technical sectors. We want to consolidate all this information and have this knowledge base readily available. If we have this knowledge to hand, we can make really informed decisions about how we design, how we implement, and how we monitor and evaluate our programs. So as someone said, we're not repeating the mistakes of the past, and we're learning from what we do. And because we have all this evidence to hand, we're pretty confident in our decisions when we decide to change and adjust our programs, because we have collected the evidence that informs the changes that we make. This principle also helps us to build and share information about our achievements, about our failures, about our best practices, about our lessons learned. And we want to share this information across various levels. So not just internally within our respective home offices, but also across the network, and also to our external stakeholders. So our donors, our implementing partners, as Yetunde said in the accountability section, our beneficiaries and the communities that we serve. So by sharing what we know and what we have learned, we can help other implementing partners to benefit from the knowledge that we have acquired and to use it to inform and influence their own practices and their own strategies so that we're all working towards the greater good. The more we do this, so the more we build evidence of what works, the more we share the capacity that ADRA has, the more trusted we become as an organization, the more we are leaned on as a competent and valuable partner in development, who donors want to fund and who other people want to work with, because we're demonstrating that we know what we're doing. Next slide, please, Fahim. So the principle of learning and sharing really helps us to make sure that learning is at the core of our project implementation. But the million-dollar question is, how do we actually operationalize this? How do we achieve this principle of learning and sharing? What is ADRA's approach to learning and sharing? So the first way we want to include learning and sharing into our projects is by building staff capacity in knowledge management and learning. We want all our staff to be aware of the key concepts in KM and learning, and we want them to be familiar with the tools, the practices, the products that they can use within their projects to be able to manage what the knowledge they're developing well, and to be able to learn from what they're doing. To that end, there's one tool that I want to highlight here. Carrie, can you pop the KMNL training link in the chat box, please? So at ADRA International, to help our staff understand what knowledge management and learning are really about, we developed a self-paced course. It's about 40 minutes long that really just introduces you to the concepts of knowledge management and learning and showcases some of the tools and the approaches that you can use within your programs. The second tool that I'd like to share is the knowledge management and learning integration checklist. Carrie, if you can pop that in for me as well. And this is really just a menu of tools and approaches that you can select at different points within your program. So there are some tools that are appropriate for the design stage, some tools that are appropriate for the implementation stage, some tools that are appropriate for wrap up and exit. And it's really meant to help you select appropriate knowledge management or learning activities that you can integrate into your program. And we have a grand plan to translate these resources into at least French and Spanish so they can reach a wider proportion of our staff. So we'll let you know when we get there. So the second way we want to kind of institutionalize learning and sharing is to build this really robust programmatic evidence base. We want to get to the point where we have an electronic knowledge and evidence repository that has all our evaluation reports, all our research findings, all our lessons learned, our promising practices, all these learning products consolidated in a centralized location. And the idea is that our staff have easy access to this repository, and they can just retrieve these resources as and when they need them to constantly inform and improve the projects that they're implementing. And the final way in which we want to kind of operationalize learning and sharing is really to work on continuous learning and reflection across our programs. So we want to take advantage of all those opportunities for learning and reflection with our partners, with local and regional actors, with our donors, so that we are really learning from each other and using that learning to refine the work that we do. We feel that if we are working well together with the stakeholders around the development and humanitarian assistance work that we do, this helps us to make smarter decisions during project implementation, and it also helps us to reduce the duplication of efforts in what we do, and also minimizes the amount of resources that are wasted in repeating things that others are doing. So those were some of the things that I wanted to share about the learning and sharing principle and how we are trying to action this at ADRA-I and across the network. Over to you, Nesta, to take us through capacity and budget.
Okay, thank you, Yemisi. Okay, I'm quite sure that if I am going to ask people here attending the webinar that somebody have assigned you to do MEAL, and then, I don't know, you don't know what to do. Have any of you been in that situation? I'd just like to see any answers in the chat, or anybody wants to talk. Because until now, we have already see a chunk of things that meal people have to do. So anybody else that had been in a position say, well, now you are the meal or the M&E person, and then we don't know what to do. So that is why anybody, any volunteer to share their experience? Not? Okay. I think the meal policy, the meal capacity building part is trying to deal with that. And I have another question to ask. Meal task is responsibility of who? What do you think? The meal task in the project is responsibility of who? Any question? Please put your answer in the chat. Meal activities or meal tasks is responsibility only of meal people, project people, the whole project team. Okay, I can see that many of you is writing in the chat that meal tasks and meal activities is responsibility of everybody. That's correct, and that is what we're going to deal with. When we talk about capacity building here, and I found this diagram quite useful. We're talking about training first, but also the training means to learn. That's what Jamie said, just cover, which means learning means accumulate also knowledge and skills. But sometimes knowledge and skill is not just enough. We're talking about also coaching. It means having people that know the task, coaching other people just they are beginning, and also provide support with leadership, support with resources, support with the tools and equipment that people need for doing the meal task, which at the end will mean the development of the person and capable people to do the meal. Next slide, please. So in the policy, what we included and we believe is that ADRA support all our staff and partners in case when we are implementing a project in partnership. So we are supporting them to improve their meal capacity. It means to increase their knowledge and skill that are necessary to implement high quality meal. In the past, many years ago, in other organizations, not in ADRA, those people, they said, oh, you're going to do this, and in top, you do M&E. Or there is a person that, oh, this is, somebody have to do meal. Yeah, because when you have time, you do meal. No? Those times are gone. Now, donors are very demanding in terms of meal. And in general, for me, even if donor doesn't demand, I think meal is the core, is the bone of the project success. It means we have to do meal not because donor requires, but because we want to be successful in our projects. Next slide, please. So when talk about capacity building, the idea is that, as you mentioned, that meal activities is the responsibility of everybody, but at different levels. The idea, the meal policy, the minimum is that we need to include in the job description some meal objectives for different position in the project. In different levels, like especially on those doing leadership and also operations. So we need, like, from the project director up to the field people, that they understand what is meal. So the project director, that he can support with the leadership, and the officer in the field, they can understand why we are collecting the data and why data has to be quality. quality data. Okay, next slide, please. So some of the position, and these positions can change depending of the names that you have for your projects. But the idea is that the project management and implementation position have to include in the job description meal objectives. And we're talking about if we have a specialist like agri specialist, a nutrition specialist, healthcare specialist, depending on the project. So we need to include also in the job description some meal objectives so that people can assign time and also time to be involved on those tasks, and they are aware that they have to do those responsibilities. Next slide, please. And also, again, program and project staff are training on meal tasks. We need, sometimes we say people, you have to go and collect this data, but we don't tell them how the data have to be collected or what tool they're going to use, and we don't train them in the use of the tool. So the result should be that that task is not definitely going to be well done. So the idea here is we stress again that program and project staff needs to be trained on the different meal tasks that they are assigned to. Also, ADRA ensure that staff assigned to the various meal responsibility have the skills and the knowledge required to perform allocated tasks. As I mentioned at the beginning, it's very frustrating that you are assigned to do a meal task and then you don't know what to do because nobody told you. And then you have to learn the hard way. So we need to avoid that. And then right from the beginning in the planning, in the project, we need to include also capacity building, meal capacity building for everybody, and also specifically more detailed capacity building for the meal officer or the meal coordinator, whatever name you are assigned to that person. Next slide, please. As I mentioned, ADRA recognized that the responsibility of meal are not limited just to the staff that are supervising meal, meaning that sometimes there are the idea that if we need to collect data or quality data, that is the meal officer responsibility. It's not my responsibility. But we have discussed this and we recognize that the meal responsibilities is not only for those people, for the meal staff, but also is for other positions, as I already mentioned. That should be when we do capacity building meal, we need to include at different levels. We need to include programmatic people, meal staff, and anybody that is included in the implementation of the project. Next slide. Okay, before going to the budget, I just want to mention that the MEAL TLL, we have been running capacity building sessions. I think we have done already 4 in Thailand and have been very successful. The idea is that we want to improve the knowledge and skills of MEAL on for the whole network. So when you hear about the because of the pandemic, we have stopped doing that. But when hopefully next year, when you see a link about invitation, is that what we talk about capacity building? Because meal industry, I would say, is very evolving. There are a lot of things that are coming new and that we need to do continuous learning. So the MEAL TLL is doing this, trying to do that continuous learning, and also we are producing some resources. We're going to sharing. We have a MEAL website, and also we have a group to discuss things about MEAL, so that we'll invite you to be participate in those activities. Okay, just to let's talk about the meal budgets. I don't know if some of you sometimes when we do budgets and when we do proposals, the last things that we remember is to include a budget for meal. And when we try to do adjustment, because the donor has said we need to adjust the budget, the first line that is gone, meal. I don't know if that happened to you, but sometimes I remember one time, and they say there was one project that said that they are going to do a baseline, and they asked me to support them to plan the baseline. And then I asked them, let me see how much budget do you have for baseline. And you know what? When we look at the budget, there was $0 for a baseline. So at some time, well, it's probably some other organization, not that, and I know that you are quite careful and you put budget in there. So the idea here is that please don't forget that meal activities needs to have resources. If we don't assign resources in the budget, in our proposal, meal activities are not going to be able to be done. So be sure, please, to include and budgeted properly the meal activities. Next slide, please. The idea here is that the people that participate in the budget, and if we don't have a meal person included participating in the proposal, at least the program people needs to know what are the things that we need to include in the meal. Also, if we have a meal officer, we suggest that that meal officer be part of the proposal team so that he can come out with the budget. So we need to prepare a detailed budget for meal activities during the project design, because if we don't put in the design, in implementation, it's going to be harder to include those ones. We need to include in all the proposals, and I'm going to tell you more later on what are the costs that we could include, but it will depend on the size of the project, it will depend on the complexity of the project, and it will depend also on the time frame of the project. Next slide, please. First, your budget has to be developed based on the meal activities that you are included in your proposal. And also, it depends of how do you want to do meal. Are you going to do paper-based meal? So you need to include the cost of those paper-based. Are you going to do electronic data collection? Are you going to do remotely data collection? So those costs have to be included in the proposal. Like if you are going to use a software, what software you're going to use? Are you going to do Kobo Tool? Are you going to do Logalto, ODK, any other software? Are you going to use tablets to collect the data? So if you do, you have to include that those costs into the budget. Are you going to print formats? You need to include the cost of that. I remember that in DRC many years ago in the project, we everything was printed, and the cost of printing, we ended up that we have to print like 5,000 copies in a quarter. So that cost. So please include those costs in the budget. The rule of thumb is that 5 to 10% of the whole proposal has to be dedicated to meal in the budget. It could be, and now some of donors are pushing a lot on to respect those lines. The maximum that should be 10%, and the minimum that should be 5%, and they're depending of the size. Sometimes it could be 3%, but the idea here is that we need to include a budget for meal activities. Some of the next slide, please. Some of the before that, go ahead. Okay, some of the activities that we need to include, that we need to budget in our meal budget is first personnel, then equipment. What kind of equipment are we going to use? Are we going to use tablets, the laptops to collect the data? Are we going to use Excel? At least we have to do the software. Are we going to analyze data with SPSS? So we need to include the cost of the software. Other thing, we need to include trainings. If we're going to do a baseline, we need to budget the baseline and it's the baseline and midterm evaluation. Are we going to do a performance evaluation? Is going to be internal or is going to be external? If it's going to be external, we need to include the cost of the external consultant. And again, depending on the size of the project, I always say the MEAL system has to be tailored to the size of the project. You know, if the project is 1 year or 6 months project, it's going to be different than a 5-year project. The MEAL system is going to be more complex. If it's an emergency program that is 3 months, 4 months, so the MEAL system is going to totally be different. So again, the budget has to be according to the size and the time frame of the project. Other thing that we need to include, if we are doing, for example, quarterly reviews, we need to include those costs there. If we are the reporting, okay, how often we're going to do reports, we need to include the cost of the reports. Are we doing PDMs, post distribution monitoring survey? We need to include those costs in the budget so that we don't have surprises when we want to implement and then we don't have money. So please be sure that you include the minimum requirements according to the MEAL activities that you have you included in your project. Thank you. This is what I would like to share, and we are ready for any question that you have, not only for me, for all the presenters now.
Thank you very much, Nestor. Thank you to all of you, Yemisi, Yetunde, Sarafide, Nestor, for doing this presentation. We have, in the meantime, we have collected also a number of questions which were in chat. We will actually start to read them. Thank you also to Daria to summarize all of them. Actually, colleagues, so when I'm thinking about my past, you know, so, and Nestor was talking about this, the MEAL is totally different, the monitoring evaluation as 10 or 15 years ago. I could remember the time when I was doing the training, so in evaluation, the teacher came to us and asked us, the students, who was actually the first one in the history of the earth doing the evaluation, doing the monitoring and the evaluation. So we were not sure, you know, so because this was a secular teacher in a university, and then he referred to the Bible, and he said actually the creator, the God, was actually the first one doing the evaluation. And I was right now looking for the Bible, and in the first chapter, actually, when you are reading the report about the creation, so in the Genesis of the Bible, always when this creation happened after the day when God was actually working, then he was saying at the end, God looked at everything he had made and he was very pleased. Yeah, so some Bibles are using he was very pleased, he has checked everything, and some Bibles are saying everything was good what he has done. So, and this is impressive for me. So the creator himself, he has a plan for the creation, and he has also a plan which was actually ending in the evaluation. He monitored what's happened during the day and after the day. He was just pleased what he has done. That's a nice idea, I think, which could also lead us in the future when we are learning and when we want to learn more about evaluation, accountability, monitoring, and of course the learning process. So let us come to these questions right now. So I do have here some. The first one is actually coming from Harriet. The MEAL policy is silent on the type of reports to be shared. So anybody like to respond to?
Can you repeat the question? Sorry, Thomas.
The MEAL policy is silent on the type of reports to be shared. So that's true. So there is not a special section really referred to the reporting, but so far as I know, I was checking this. There are also some.
I can respond to that one
for midterm and please.
Okay, when we're talking about accountability, we're talking about accountability first to our beneficiaries and accountability our donors. So we're talking about accountability and how we are accountable to our donors through the projects, through the reports they are requested. Depending on the donors, they will require quarterly reports, semi-annual reports, annual reports on end of project report. So yes, they even if had not been mentioned generally, but the policy actually under the accountability section mentioned that accountable to the donor means provide compliant with the reports on time and with the quality that is required. Back to you, Thomas.
Okay, thank you, Nestor. So then let us come to a second question, which was actually given to us by, now it's a little bit difficult for me to say this name, Yusuf Mosa, hopefully it's right. The question was how to collect data in an emergency.
You are directing to who the question?
Oh, okay. Thomas, I just want to make a quick comment on that. When it comes to emergency situations, there are quite a number of ways by which we can collect data. One thing that we must keep in mind is that we cannot collect data the regular way. So you can use the rapid participatory assessment, the different rapid participatory assessment methods. Also in emergency, the secondary data becomes very important. You can collect data using what is in existence, especially from the UN. It has to be a credible source anyway. You know, you can pick information from the media houses. I'm not talking of social media, although you might get something on Twitter, but it has to be credible. That is what is most important, because there will be no time for you to go out and start to collect through the normal process of administering a questionnaire and so on and so forth. You can also do desktop reviews of what has happened before, and you use that to sort of synchronize your information together. I think Nestor has something to add to that.
I'd like to, well, I think the question was not, was very general, because what Yetunde had mentioned is correct. That is when we are like doing the need assessment to respond to the emergency. But if we're talking about collecting data when you are already implementing, already responding the emergency, so again, I think now with the electronic devices that are there, is a good way to collect data. Specifically, when we do an emergency response, in the first part of the response, I would say the MEAL system is more informal until more or less stabilized, depending on the length of the emergency, we are going to do more formal collection. But like, for example, the first thing that we are doing in emergency is distribution of things. So we need to organize very quickly how we're going to distribute, and also keeping track of what has been distributed to who, and also very quickly do post-monitoring distribution to see the quality of the item that we got distributed and how we can, on the way, improve the distribution and the quality of the item. Back to you, Tom.
Okay, thank you for this response. Actually, so you have also mentioned before the real-time evaluation, which is a part of the emergency. It's not the monitoring, but it's the evaluation. But this is a collection of data simultaneously with this response. And I think that is quite important for all of us to understand. It's a different setting in emergency. And even the criteria are a little bit different. So, for example, the OECD criteria, which are mentioned at the beginning of the meal policy, and which relates to this efficiency, and let me read them. Relevance, efficiency, effectiveness, impact, and sustainability. So they are different. And maybe Nestor, you could also give us the idea of what else is necessary to evaluate in emergency.
Well, evaluation in emergency is a bit more challenge because evaluation in emergency, there is a lot of turnover of people, especially staff, and also we have to be quick, and sometimes that is why we talking about real-time evaluation, because real-time evaluation is more on improving, on adapting the intervention on the go, rather than when we do at the end of the project. It's to see how the intervention have improved. But the challenge that we have there also is that when the emergency has ended, we don't have the beneficiaries. Sometimes we don't find the beneficiaries that had been the emergency benefited to interview. So those are the challenges that we have to take in care. What I suggest, one of the good resources is the ALNAP. ALNAP have especially the guidelines specifically for doing evaluation for emergency. I will send the link afterwards with the recording of the presentation. We can send some of those links so that people can refer to more specific emergency evaluation. There are pros and cons, but real-time evaluation is the one that right now is being used in a lot, like a formatted evaluation in emergency. I don't know if that responds to the question, Thomas.
Okay, thank you. That's perfect so far. So they have these criteria described there. Anyway, there's a very special question which we have received from Jibrila Madago from ADRA Niger. Sorry for this pronunciation again. How is the ADRA meal system in line with the gender-sensitive monitoring and evaluation? So.
I already sent a response on this, Thomas. Mm-hmm. And I want to confirm here that as a meal system is different from each project, gender-sensitive meal aspects should be included in the project theory development process during the design phase. And then it should come out through implementation more strongly. In most of the time, we can easily check in the disaggregation of the data collected. Thank you.
Okay. Anybody else like to contribute to this sensitive question, maybe?
I think the meal system will depend on, we talk about gender sensitive. I think the first thing that is the activities have to be designed with taking into account gender sensitive. And based on that is the meal system and going to be designed to collect the data needed for that. So I said first is the intervention that needs to be designed, taking into account gender sensitive. It depends what we want to achieve. I add that.
Okay, thank you. I have here another question from Harriet from Uganda. Under the design phase, I think we need to include need assessment to engage the targeted individuals to avoid donor-driven project, but the policy does not mention needs assessment. So this is a question for Sarafidi. Could you respond to this?
Yeah, just confirm that need assessment is need to be put in place in project design phase. It should be before the development of project theory. Yes, thank you.
Mm-hmm. So the policy is just concentrating on the meal, and that's true. So without data, without need assessment, we wouldn't be able to monitor and to do the evaluation. So the policy also refers to the baseline study, so which is also very important. Without baseline study, we don't have the comparison between the data. Thanks for these questions, which help us also to understand the whole system as such.
Thomas, just to add it here, the policy just include need assessment, because the policy say that every other project have to be designed based on a detailed and thorough need assessment.
Yeah.
And there is a question on budget for need assessment. Unfortunately, budget for need assessment is before the project. So it's not included in the budget of the proposal, because the need assessment is not covered by the donor. That has to be covered by the country office.
Yeah, thank you. So for the clarification, another question is about the external and internal evaluation as such. So what would you prefer? So for evaluation, so to go for external one, which is sometimes pretty costly, or to have an internal evaluation just done by somebody else who is doing evaluation in your office, or maybe colleagues from other offices?
Okay, this is a great question, and I'd say there is pros and cons for each one. Let's say an internal evaluator, the pros is that he knows the project, he knows well, and it's less cost, and he doesn't have to read all these documents in 1 week in order to understand the project, because he has been covering the project. So he have the idea what project can want to achieve, and it's less costly. The against point should be that sometimes they say subjectivity, because sometimes his boss or her boss have some bias, and that would say that, oh, it's more objective and external and that and internal, which is not necessarily true. The external one, the pros is that he comes with new eyes. He didn't know the project, and he looked at it apparently more objectively. But we need to know that sometimes the external evaluators, they come with their own agenda, which means that they focus on the things that they are interested. And I have seen that by experience. So they put more emphasis on what, if they are doing some research, they put more emphasis on that. Another cons about external evaluators are more costly depending on the size of the project, depending if it's an international one or it's a local one. So it would be hard to say which one is the best. It depends on the situation. If your project doesn't need, and now even the donors, they understand that, and there are some of the donors said, okay, baseline can be done by internal or external or a combination, but sometimes, most of the time, is final evaluation that is required to be external. But again, is pros and cons on both. Don't tell that, oh, the panacea is external, because it's not that. Because sometimes they have to read all the reports for a 5-year project in 1 week to understand, and then go to evaluate. So I hope that answering part of the question.
Yeah, thank you very much. I'm coming to the next question, which is from Jibrilia from ADRA Niger again. Under accountability, does ADRA MEAL consider environmental safeguarding? So this is Yetunde for you, this question, I would say.
Thank you, Thomas. And that's a very good question, because at times we tend to concentrate only on certain aspects. The MEAL policy takes care of all aspects of the resources we're using. If we're talking of the environment, it is expected that at the design phase, we're planning to ensure that we have an assessment or a statement that tells us of how we intend to safeguard the environmental resources that we are in, the situation we are working with, just in case there's going to be an impact from the activity that or the activities that we are carrying out. Except if we have to state word for word everything, but I can safely tell you that if you go through that policy, it has respect for even the resources of the environment. So it takes care of environmental safeguarding. When you are designing your project and the activities, it's part of what we normally would include as ADRA.
Okay, good. Thank you very much. Then something for Yemisi. Can you share simple tips on how to implement the learning?
Oh, sure. I think a big one is be intentional and kind of plan for it at the start, at the design stage. Make sure that you have a budget that includes the learning activities that you want to implement. Many times we wait till the end of the project and we think, oh, we'd love to have a lessons learned workshop. And then you look, it's the end of the project and there's no money for it. So I think at the start, make sure you have identified these key points for learning within your program and make sure you have the resource to do it. And I think keep it simple. It doesn't have to be a new and separate thing or activity. Take advantage of the events that are already planned for your project to introduce some learning. So for example, you can organize pause and reflect moments after key events within your program. After this webinar, the hosting team will do an after action review to see what went well, what didn't work so well, and what we could do better for the next time around. You know, try to create opportunities to regularly review and use your monitoring data that you're collecting. You know, this can be during team project meetings. It can be during planning sessions with stakeholders and external collaborators. Just simple things that you can do to kind of include learning into the way that you're working. Over to you, Thomas.
Yes, thank you, Yemisi. So actually, we are talking all the time about the meal and meals, and I'm getting a little bit hungry, I think, you know, so for food. But on the other hand, when we are talking about the monitoring, evaluation, accountability, and learning, so we should be hungry for the knowledge. So I guess that's the time to be hungry for knowledge. And thank you for sharing with us those ideas, Yemisi. I think that's so important. So to keep everything in mind, but go to the next stage and then really learn and then use this knowledge for the programming, for the next projects and so on. So we have here a number of questions related to capacity and budget. I could imagine this is a huge sector. Without money, it's difficult to make any monitoring and evaluation. So let me come back to Nestor, to you, because this was a session done by you. So there's, for example, the question from Amal. Does the budget percentage for meal activities include staff cost or staffing cost?
When you talk about staffing cost, meal staff cost, or just staff in general?
I don't know. I guess the staffing cost the meal, I could imagine.
Yeah. In the meal budget, we need to include the staff, of course, and the staff will depend of the size of the project. because it could be just one M&A officer, meal officer, or it could be more than one. So definitely, yes, we need to include the staff costs in the meal budget.
There's also a question which relates to the administration budget. Harriet is asking this question. Admin budget should also have a budget line for meal, so which is maybe a little bit different, you know, the admin budget and then meal budget is also with the planning and all these resources. So, and she's saying here research and development, needs assessment, and so on. So maybe she's also referring to the knowledge management, to research, including research. What do you think about Nestor?
Okay, we're talking about we're talking about admin costs. If we're talking about doing research, if the project including research, that budget have to be included in the meal budget, not the admin. If let's say the budget of meal related budget in the admin cost is if the leadership is going to participate in any meal activities like let's say midterm review, and they're going to the review is going to be somewhere else that you need to travel, so they need to include that budget on that one. If they are going to attend for this research study we're going to do. So it will depend of what activities the project has planned that we need to include those costs in admin if they are going to participate.
Okay, good. The other question, again, close to the budget is what will happen when meal activities are to be done but have no allocation of the cost in the budget? Yeah.
And that is the typical. Well, that is why I think in order to prevent that, the first thing that I've said is not to go to that, but to prevent that. That's what we need to do the budget during the design. And unfortunately, sometimes it doesn't happen. If we have a meal activity that have to be done, even sometimes it's worse that they don't require and we haven't done the budget, I think we need the meal person have to negotiate with the program, with the project manager to let them know that we need to make savings somewhere else because this activity is mandatory and we have to do it. No, that is the step that we have to do, is negotiate and see if there is other lines where we can save. That's the only thing that I will recommend. But if there is no budget, we cannot do the activity, and that actually worse.
Yeah, thank you. Another question, to what extent can the meal team engage in the project financial monitoring?
Okay, accounting, they do their financial monitoring on a regular basis because accounting, they do the accounts on a daily basis. So I don't think the meal person has to go and do that financial monitoring because they are already doing that. But what we can do is when, let's say we do on a monthly basis, meetings on a quarterly basis or midterm review, we can request information from accounting and say, okay, give me the budget expenditure so that we can compare the activities that have been implemented with the budget that had been spent. Because what can happen sometimes that we have spent, let's say, 50% of the budget already, and we only implemented 10% of the activities. So, and that should be a problem. Or can be the other way around, that we already spent 70%, we have implemented 70% of the activities, but we only expend 20% of the budget. So say the question is why we are saving, we budget too much, or we have doing some alliances that we say things. So in that sense, I will ask the meal people to work with accounting to ask them to provide those budget expenses so that we can compare during those reviews, but not to actually do the finance, because programmatic monitoring is already a lot to add something that accounting team is doing already well.
Okay, thank you. We have another 2 or 3 questions still here. Colleagues, I would like to ask you to be short in response because we are coming close to the end of the time. But anyway, again to the budget, please, Nestor. So there's a question. Do we budget also the accountability to affected population in the meal for staffing?
Okay. Yeah, I know that the section accountability to affected population is a section in the more of the UNCID project that is being required. I said it will depend of the activity that we are going to do. It depends if we are doing a specific intervention that requires a lot, that we need to hire a specific person to do that. But the activities like accountability to affected population is one of the activities should be to include a feedback mechanism. That feedback mechanism has to be budgeted, but also that can be dealt with the meal people. How to deal with all the complaints, with the feedback. So that is part of the accountability. But if the project is that large that you need to include a specific person to be in charge of all those activities, accountability, I would say yes. But not necessarily in every project we have to include that person.
Yeah, then probably the budget for meal will even pass the 10% limitation. So actually there was a question if the budget could also increase the 10% in some projects. Again, a question to you.
Okay, if the budget, if the meal budget is more than 10%, I will be a little bit worried because it means that, well, those thresholds have been included based on international experience. I would say that, let's put it in one way, is like it's costing me more washing my shirt than buying the shirt. You know? So if it's more than 10%, I will be worried because that is something is wrong there. Because let's say if it's a $10 million project and we say more than 10%, that should be how much? You know? So I think we need to be very careful. The ceiling going more than 10%, it could be, but I think we need to be very clear what to include in that meal budget. Some donors right now, they are requiring that in your meal plan, in the proposal, you need to include the budget, the summary of the budget, so that they can compare the percentage that is in the meal budget compared with the total budget of the proposal. So some donors are doing that now.
I know for example, for the European donors, they are going up to 5%, let's say. So they don't like to go, for more than 5%, only in special cases and special situations. So I have maybe the last question, but this is not related to Nestor. He was talking a lot right now. Thank you very much, Nestor. But I would like to ask Yetunde. This is something about the data protection and privacy, So from Yataka Joseph, the question is, how can ADRA ensure data protection and privacy while responding to accountability to the stakeholders?
Let me say that in accountability, we already have like ground rules as to what you say to the people. While you want to be transparent and factual, you are being transparent on what ADRA will do, what you expect from them. I had this example of a country office which told the people the exact amount of money that they were collecting from the donor, which was a mistake. What you tell them is what you intend to use for the activities that has to do with them. Because when you tell them the overall budget, you do not go back to tell them how you have broken down the budget. And so when it got to a point in implementation, the community people rose up against that particular ADRA country office. They actually went to the newspapers and they said, this office told us that this donor gave this large amount of money and we are not seeing them spend it on us. What we are seeing is that they come to the field in the four-wheel drives. So we are not talking about overall amounts that we get from the donor. We are talking about what concerns the people, because all the money you get from the donor is not going to be expended on the whole of one activity or some activities. It's going to be for different things you have put in the budget. So we need to be careful. We create the protection around knowing what do we say and what do we not say. Another example I have is when the people in a refugee camp were trying to attack a particular office. And then what the people in the refugee camp knows is that people come in their four-wheel drives. These are the people who implement projects for us. So they started by attacking ADRA, and then suddenly somebody said, no, you should read the label on the car. Look at the visibility that they have brought. This is ADRA, it's not the NGO we are fighting. So we create the protection for ourselves on the sort of things we tell the people. And that is why, especially when we are doing the selection of beneficiaries, we also use the people, we use their own communication system to tone down the information and to know which information we are giving out and which one we are not giving out. I don't know if Nestor has something to add on this protection. I also know that there's going to be another webinar sometime around the fall season for us to talk about the feedback mechanism and the issues around data protection.
Yeah, the only thing that I would like to mention is that ADRA International has prepared a data protection policy also, that at some point we are going to do another webinar so that you can have an idea how you can adapt or adopt that policy, because that is not going to be network-wide, but at least for all the projects that ADRA International is implementing in different countries. But I think that data protection policy have most of the common elements that any project, any country can use. So yeah, we are going to, we already have that and it's being approved. We had worked with an external consultant and we will share with you later on.
Yeah. Thank you very much, Yetunde, and also thank you for your comment, Nestor. So the GDPR is actually a part of the system in Europe, and I think this is a big question. We need to work on this data protection for our beneficiaries, and I'm sure we will also continue discussing this in the future. So, Nestor, you have now the chance somehow to wrap up, you know, and to say some nice words, you know, so to somehow summarize this webinar.
Thank you, Thomas. Yes, first of all, I'd like to thank you, everybody that joined today, our webinar. I know that everybody is very busy, so thank you. We will continue doing this kind of webinars in the future. And also I want to mention that we are going to send you an evaluation of the webinar. Katie is going to send you probably tomorrow. Please feel free to fill out that evaluation so that we can know how to improve the following webinars. And also, I want to mention that the recordings of this webinar, we're going to send you via email. And if you have any further questions about any of the topics of the MEAL policy, please feel free to send us the the question by email so that we're trying to answer. Also, I want to mention that we are going to send the presentation translated in Spanish and in French. We apologize that we haven't been able to provide interpretation for French and Spanish, and this has been only being in English. Probably, I not promise, but later on, we're thinking maybe we can organize the same webinar, but in Spanish for Latin America and some French-speaking countries. But that is something that it could be later in the future. Again, thank you very much for your participation, and that's it. Thank you for my part. Thank you for my colleagues.
Okay, thank you. Thank you.
Have a great day.
Yeah, and also from my side, I want to express my thank to you, because we have our busy schedules, but you were able to join us for this webinar. I want to also thanks to the speakers, to the presenters, and also the whole MEAL TLL team, which was actually behind and is behind these webinars, you know. So thank you very much for supporting. And of course, now we are coming from the hunger for knowledge, this meal to the other one again, you know. So now you will have the chance to get the delicious food and the other meals. And I would like to wish you all the best wherever you are, and whatever you like to do and eat, and whatever you are doing right now. I wish you all the best. And of course, please stay with us still, stay with the MEAL group, and give also some inputs from your side, ask the questions. There is an option to do this. We have a special...
Can we take a picture of people? Kerry,
okay,
can we take a picture?
For this. Yeah.
Can everybody turn on your camera so we can take a picture? Okay, so Kerry, can you take the picture?
Sure. Let's see. Okay, everyone smile.
So cool to see everyone.
Yes, it is.
Yeah. Thank you, everybody.
Thank you, everyone.
Hey, Luis, bueno verte.
Thank you.
Thank you. Bye-bye.
Thank you. Bye.
Bye, Nestor. Bye-bye.
Bye-bye.
Have a good one.
See you around.
Yes.
Thank you.
See you in Madagascar next time.
Yes.
Yeah.
Thomas,
Bye,
good to see you, man.
Thomas. Bye, Thomas.
Bye, bye, Luis.
Bye, everyone.
Luis,
Bye.
Luis Miguel, how you doing, man?
Hey, man. Alexander Isaac.
Yes,
Bye.
boy. Good to see you, buddy. Good to see you, buddy.
Yeah.
Bye.
Thank you, Kerry. Thank you all.
Okay,
Thank
Thomas.
you, everyone.
Good to see you.
Good
Good to see everyone. We'll see you next time.